My name is Michael. I'm the lead advanced clinical practitioner in haematology, and this is the acute sickle cell unit at Lewisham and Greenwich Trust. The unit opened in January this year and is set out in phases to reach 24/7 by December. The idea of the unit is to provide a 24/7 bypass for sickle cell patients who present to the emergency department to come directly to our unit instead, to be treated by people who understand sickle cell and have training in their management. One of the big things we wanted to do was making sure the patients actually feel more listened to and cared for. You know, the treatment can actually be very similar, but what we really want is that the patients can actually just talk to us properly and actually just say, look, yes, I'm having a crisis, and yes, you can manage that, and I feel much more reassured with that. But all the other little things in my life, like social issues or housing issues, or how, you know, my periods can really have a knock-on effect onto my crises, we can help manage that kind of thing as well. So we're much more of a closer knit tie with all the other services that they may need. It's not just about treating their crisis. It's also about all the other parts of their sickle cell care and all the other things that we can do to help them. So previously across London, sickle cell care has had a number of challenges, specifically around in A&E waiting times and management of their painful crises. By coming directly to our unit, you're treated by somebody who understands the disease and has training specifically in haemoglobinopathies that can manage your disease properly. What we have found is that the time till treatment is quicker and that the overall care is seen in a more prompt fashion with more care and compassion. Available to any patient in the area who has sickle cell disease and believes they're going into crisis. The process of being referred into our unit can be direct from the patient themselves. We have a dedicated triage line that a patient can call, or if an ambulance is on scene with them, that they can direct the ambulance service to call to talk to one of our clinicians directly. We can then advise them to come into the unit or give them advice over the phone. We've received great feedback so far from patients who've experienced our department. We're here to listen and understand the patient's condition. We're not just here to treat and give analgesia, and we grow a real community bond between the patient and ourselves.